The New Zealand Cruise Association is accusing health officials of unfairly rocking the boat by warning people off overseas cruises. Official government advice on MFAT'S Safe Travel site says New Zealanders, particularly those with underlying health concerns, should reconsider taking an overseas cruise at this time due to COVID-19. It says close contact on board can speed up the spread, and some ships have been declined entry to ports, which can have significant consequences for travellers. The Diamond cruise ship, dubbed the floating petri dish, spent weeks in lockdown in Japan after passengers tested positive for COVID-19, and New Zealanders on board were placed in quarantine at Whangapaora on their return home. But Kevin O'Sullivan from the New Zealand Cruise Association says they're being unfairly targeted, and he does not accept the idea that cruise passengers face a greater risk than others.
The reality is it still continues to be a safe environment. The standard of hygiene on cruise ships is very high, and it's been ramped up even more recently. Now, the people boarding cruise are quite strictly controlled. Those who are boarding in New Zealand go through a long questionnaire process, as well as being monitored by medical staff before they can go on board the ship in terms of the temperature control and so on. So the cruise industry worldwide and locally is taking it very seriously and wanting to maintain the level of hygiene and increase it on board. So you will find that when you get on board a ship, the levels to cleanliness will be higher than probably you're likely to get anywhere. So I think that's why we believe the industry has been unfairly targeted.
I want to talk about your increased hygiene and cleaning in a minute, but first, medical professionals say that you may not exhibit symptoms of coronavirus for 6 to 7 days. So even if you're taking people's temperature, someone could develop the virus once they're on board. And this warning goes on to say that the virus can spread quickly on board cruises due to close contact between passengers, and that cruise ships have indeed been put into quarantine. We know that. Cruise ships are a risk, aren't they, Kevin?
I don't think they're any more risky than any other environment where people are likely to be mingling, and I include concerts, going to movies, any area where you may be in close contact with somebody else. And in fact, as I said, I think they're a safer environment because they're a cleaner environment.
What's the average age of a person on a cruise?
Generally, New Zealand, it's around about the median age is around about 50. It's not the elderly and infirm that people seem to think travelling on cruise. It's a whole range of ages, from babies all the way through to older people.
So, and on a normal cruise, how often would you have someone die?
I don't know. I don't think anybody keeps any information like that. But I also liken it to a population of a small town. 3,000 to 4,000 people in a small town. You're going to have somebody sick of something at any given time. But it's unlikely to be COVID-19. They could be coming down with a cold or have some other ailment just because of the sheer size of the population.
That age of 50 that you gave me is the midpoint, isn't it? You would, have a number of people who are, 70 plus on board?
Yeah, I guess, again, like any demographic of a number of people of that size, you have a full range of ages.
And we know from the statistics, those are the people who are most at risk from coronavirus, aren't they?
Well, I'm in that category myself, and I guess I don't particularly feel that I'm any more risk than anybody else. And I think it's unreasonable, really, to target, again, the fact that crews might have older people. Everywhere has older people.
So are you planning an overseas cruise anytime soon?
I would love to. I'm certainly not planning on curtailing any travel, and I'm looking forward to taking another cruise later this year, and possibly again next year.
Okay, so in terms of increased health and safety measures, what are cruise ships doing differently?
Well, as I say, they do have elevated cleaning regimes as well now too.
So what does that look like?
before this came in, you always had a lot of cleaning bays before you went in to eat. That's been ramped up, so there are places to clean and make sure you're washing your hands thoroughly in many other areas of the ship now. Plus, bear in mind that they have very good medical facilities on board the ship as well too.
So increased cleaning prior to meals. Anything else?
The cabins are cleaned regularly as well too. Every surface is cleaned regularly. As I say, the hygiene standards are greater than pretty well any other area that I can think of.
So to be clear, Kevin, do you not accept that there is potentially a higher risk to people on a cruise ship than, say, some other environments?
No, I don't accept that.
And so your advice to anyone considering a cruise would be what?
It's great fun. Go and do it. Don't let what's happening at the moment ruin your life for some unreasonable and irrational fear.
And to the people who have given this advice, because it is obviously official government advice on the Travel Safe website, what do you say to them?
Well, I would like to think that they will reevaluate it in as short a time as possible, and not just in New Zealand but at other places as well, and look at what the real risks are and get back to what should be a fairly normal state of affairs. I'd like to think that would happen sooner rather than later.
And that is Kevin O'Sullivan, who is from the New Zealand Cruise Association.